Good morning.
Morning.
Okay, so tell me your story.
Um, so, give me a second. Let me see if no, it's fine. Um, you know how sometimes you can hear yourself when you
Yes,
go into lives? Yeah, it's a little off-putting, but I'll survive.
yes. My volume going down can change it. I have that happen on my side sometimes too, so I get it. Um, is that any
Um,
better?
uh, it's fine. Um, so I think if I'm going to pinpoint when the anxiety got incredibly difficult, I'm going to say 2023 into 24. I was in Kansas living with my sister and her family, and things went bad quickly. And I had to make very quick decisions and make incredibly fast arrangements. I call the anxiety from that point. It's a little less now, but I called it my imaginary tigers
Hmm.
because, like, consciously, I knew there was nothing around me happening that was driving the anxiety, but it was like my body was constant, like, oh, they're coming, watch out.
Yeah. Had you ever had it like that or any presentation of anxiety on any level prior to 2023?
Yes, but it was highly situational. Something would happen, or there'd be elevated stress. Um, it, it wasn't a consistent entity in my life.
Okay. It was more situational. Would you say that you tend more towards anxiety as, like some people tend towards depression or they tend towards anxiety in general?
I would say definitely in the last 3 years or so,
So
but
since 2023, but not before that.
yeah,
Okay.
no.
Okay. And your sister, so without even needing details, because it's just very interesting, I was in a very similar situation to what you're discussing. So I actually understand exactly what you're saying about living with people and then it going bad fast and then having to make quick decisions you weren't anticipating. So situationally, I understand, but I'm wondering about your relationship with your sister or whoever else was in that house.
Um, Prior to the decisions having to be made, there wasn't much of a relationship for at least 6 months. Um,
Because,
I'm not sure what was going on with everybody. I know that um, her husband had been incredibly depressed for months, maybe even more than a year.
okay.
And it presented in him as quiet rage.
Hmm.
And then my sister was also dealing with a lot of, um, I'm trying to remember the words that she used. She felt like a failure all the time. Like,
I'm so sorry. I'm so sorry. You need to
no
go.
worries.
Oh my gosh. I apologize.
Littles,
Yeah,
sometimes they need.
well, he does not. They're very well tended to at the moment. So I'm sorry, you were talking about your sister.
Oh, she was feeling like a failure all the time. Like she
Hmm.
couldn't And anything she was doing well at, she felt like everything just fell off. And so that had her very stressed.
So there was a lot going on in that house emotionally.
Yes,
Okay.
it was incredibly charged,
Yeah.
but
And it sounds like that's a part of what
also,
happened and you had to leave. Is that what had to happen?
yes.
Okay. Also, you were saying also?
Oh, it was an incredibly charged environment, but almost silent.
Oh, wow. Okay.
Yeah.
Okay. And what was your sister, she's younger, older?
10 days older. We don't have the same mother.
Gotcha. Okay. And so were you raised together?
No, we didn't
Oh,
get to know each other until high school.
wow. Okay. Wow, this story is very familiar. This is odd. Um, okay. So, and did not, okay. So do you know if you're an empath? I'm just curious.
Yes. I'm
Okay.
also very much on the ADHD spectrum.
Okay. So the sensation of, anxiety coming directly from the heart, from the chest,
Mm,
I think that for most people intuitively, I don't have to explain that in terms of the emotions of that, right? It's literally your heart center is disturbed. There's something that is genuinely disturbing your light, your peace, because that's the main action of the heart. It's to evenly pump blood. It's to take this oxygenated blood in and give us this life force and evenly pump that out, and it distributes the message of who we are, the simple light of who we are, right? So when that gets disturbed, our light has been disturbed, because it can't protect itself. So what happens is that it can take that anxiety and put it in different places in the body, and that tells us kind of what you're trying to do, or what's trying to happen. In your case, it's dropping right down to the heart,
mm.
to the stomach, which makes a lot of sense. So you're trying to digest this disturbance. And from what you're saying, timing wise and your history, it sounds like this is not yours to me. It sounds like this is something you picked up in that house. If the
Um,
timing is right. Is the timing right? Am I getting that right?
when, um, wow. The fact that I couldn't see that on my own.
Well,
The
honey, it's
fact that
disturbing
there's a,
you.
a chance that I can lift this up and out and release it back to the universe.
Definitely. So I did get the timing right on that.
Yes.
Yeah. So listen,